Welcome to Wonderslate. Subscribe to our Telegram channel given in the description to updates and study materials. Topic for today's quiz is Role of the Government in Health. Question number 1. What does PHC means? Option A. Private Health Center. Option B. Public Health Center. Option C. Primary Health Center. Option D. All of these. The correct answer is Option C. Primary Health Center. These centers are trained in dealing with common illnesses and work under the supervision of doctors at the Primary Health Center, PHC. Such a center covers many villages in a rural area. Question number 2. What percentage of communicable disease is waterborne? Option A. 21%. Option B. 30%. Option C. 15%. Option D. None of these. The correct answer is Option A. 21%. 21% of communicable disease is waterborne. For example, diarrhea, worms, hepatitis, etc. Question number 3. Which one is not a waterborne disease? Option A. Diarrhea. Option B. Hepatitis. Option C. Worms. Option D. Cancer. The correct answer is Option D. Cancer. 21% of communicable disease is waterborne. For example, diarrhea, worms, hepatitis, etc. Question number 4. According to data of 2000, how many hospitals do we have in India? Option A. 11,000. Option B. 18,218. Option C. 13,124. Option D. 14,231. The correct answer is Option B. 18,218. Healthcare facilities have grown substantially over the years. In 1950, there were only 2,717 hospitals in India. In 1991, there were 11,174 hospitals. In 2000, the number grew to 18,218. Question number 5. How many people die by tuberculosis every year? Option A. 2 lakh. Option B. 3 lakh. Option C. 5 lakh. Option D. 1 lakh. The correct answer is Option C. 5 lakh. About 5 lakh people die from tuberculosis every year. This number is almost unchanged since independence. Almost 2 million cases of malaria are reported every year. Question number 6. What does RMP means? Option A. Retired medical practitioner. Option B. Registered medical practitioner. Option C. Recognized medical practitioner. Option D. None of these. The correct answer is Option B. Registered medical practitioner. RMP means registered medical practitioner. In the rural areas, one finds RMPs. Urban areas have a large number of doctors, many of them providing specialized services. Question number 7. Where do most doctors prefer to settle? Option A. Urban areas. Option B. Rural areas. Option C. Foreign region. Option D. None of these. The correct answer is Option A. Urban areas. Most doctors prefer to settle in urban areas. Urban areas have a large number of doctors, many of them providing specialized services. There are hospitals and nursing homes that are privately owned. Question number 8. What do you mean by public healthcare system in India? Option A. Chain of financial faculty. Option B. Chain of private doctors. Option C. Chain of health center. Option D. None of these. The correct answer is option C. Chain of health center. Public health service is a chain of health centers and hospitals run by the government. They are linked together to cover both rural and urban areas. Question number 9. What do you mean by medical tourist? Option A. People from other village. Option B. Foreigners came for medical treatments. Option C. Indian goes for medical treatments in other countries. Option D. None of these. The correct answer is option B. Foreigners came for medical treatments. Medical tourist refers to the foreigners that came to hospitals, especially for medical treatment, where they are provided world-class facilities at a lower rate comparative to the money they pay in their own country. Question number 10. Why did Hakim Sheikh file a case in the court? Option A. Indifferent attitude of government hospital. Option B. Indifferent charges of government hospital. Option C. Doctors were not available in government hospital. Option D. None of these. The correct answer is option A. Indifferent attitude of government hospital. Hakim Sheikh filed a case in the court because of the indifferent attitude of the various government hospitals that refused to admit him. Question number 11. What do you mean by an OPD? Option A. Operation Patient Department. Option B. Outpatient Department. Option C. Out Premier Department. Option D. None of these. The correct answer is option B. Outpatient Department. An OPD is the outpatient department of the hospital where people are first brought in and treated without being admitted. Question number 12. What problems do we face in private hospitals? Option A. We have to spend more in comparison to government hospitals. Option B. We have to buy all medicines prescribed by the doctor from outside. Option C. We are also forced to avail all facilities not from outside. Option D. All of the above. The correct answer is option D. All of the above. In private hospitals we have to spend more in comparison to government hospitals. We have to buy all medicines prescribed by the doctor from outside. We are also forced to avail all facilities that are available inside the clinic which are costlier than the outside market. Question number 13. How many children die every year in India? Option A. 2 million. Option B. 5 million. Option C. 1 million. Option D. 4 million. The correct answer is option A. 2 million. According to UNICEF, more than 2 million children die every year in India from preventable infections. Question number 14. In which year the Kerala government made major changes in the state? Option A. 1990. Option B. 1996. Option C. 1998. Option D. 1995. The correct answer is option B. 1996. In 1996, the Kerala government made some major changes in the state. 40% of the entire state budget was given to panchayats. They could plan and provide for their requirements. Question number 15. Communicable diseases are spread through _. Option A. Water. Option B. Food. Option C. Air. Option D. All of the above. The correct answer is option D. All of the above. Communicable diseases are spread from one person to another in many ways, such as through water, food, air, etc. Question number 16. In 1996, the government passed some major changes regarding health. Option A. Maharashtra. Option B. Kerala. Option C. Andhra Pradesh. Option D. Haryana. The correct answer is option B. Kerala. In 1996, the Kerala government made some major changes in the state. 40% of the entire state budget was given to panchayats. They could plan and provide for their requirements. Question number 17. Public means an activity or service. Option A. Meant for all people in the country. Option B. Mainly organized by the government. Option C. Meant only for the poor people. Option D. Both A and B. The correct answer is option D. Both A and B. Public means an activity or service that is meant for all people in the country and is mainly organized by the government. This includes schools, hospitals, telephone services, etc. Question number 18. Barely %% of the population can afford all medicines. Option A. 20. Option B. 40. Option C. 15. Option D. 25. The correct answer is option A. 20. 20% of the population can afford all the medicines that they require during an illness. Hence, even for those whom one might not think as being poor, medical expenses cause hardship. Question number 19. The government must safeguard the underscore of every person. Option A. Right to live. Option B. Right to life. Option C. Right to speak. Option D. Right to laugh. The correct answer is option B. Right to life. According to our constitution, it is the primary duty of the government to ensure the welfare of the people and provide health care facilities to all. The government must safeguard the right to life of all people. If a hospital cannot give timely medical treatment to a patient, it means the right to life is not being safeguarded. Question number 20. Private means an activity or service. Option A. Meant only for the poor people. Option B. Meant for all people in the country. Option C. Organized by an individual or company for their own profit. Option D. Both A and B. The correct answer is option C. Organized by an individual or company for their own profit. Private means an activity or service that is organized by an individual or company for their own profit. Thank you for watching the video. If you'd like practice this quiz, then download the Wonderslate app now. Link in the description below. If you have any suggestion for us, feel free to leave comments. If you liked the video and want to see more of it, hit the thumbs up and don't forget to click on subscribe button to get more updates of the future videos.